Hello, everyone that is watching, and welcome to this discussion, which we're calling the Brave New World of Investing in the Psychedelic Ecosystem. I have three remarkable people with me that have been investing in this space, looking at this space for a period of time. I'm really excited to use to sort of dig into their expertise and get their opinions about investing in this landscape that's emerging. My name is Charlie Hartwell. I'm the operating partner of the Bridge Builders Collaborative. I'm based in the mountains near Park City, Utah, a little town called Hideout. And as Bridge Builders Collaborative, we're a group of investors that have been investing in sort of the mindfulness, mind training space over the last 9 years. We recently, as a group, came together and said we wanted to invest in deeper models of mental health, consciousness, and spirituality. So we kind of shifted our investment focus to go deeper. So to be able to moderate this panel with these folks and talk about going deeper and talk about this new ecosystem is really exciting. I'm with Amanda Eillian, John Cammack, and Alex. And the way that I want to do this is I really want them to each introduce themselves for a couple minutes before we start with questions. And Amanda, I'm going to ask you to go first.
Sure. So I'm Amanda Eillian, the co-founder of Able Partners. We're an early stage venture capital firm, and we focus on what we call the positive living space. So we define that as companies that are making the daily lives of people healthier, happier, and more meaningful. Early on, we focused on what broadly is called the wellness space today. So we invested in companies like Goop and Bulletproof and Daily Harvest. But over time, we realized that a lot of the wellness seeking behaviors that we were seeing in the market really seem to be symptoms of underlying inadequacies in our medical system to treat both physical and mental disorders. So with that, we have refined our focus to focus more on the consumer healthcare side and around the thesis of what we call the wellness gap, which is the disconnect between measures of economic well-being, so GDP per capita, continues to move up and to the right, at least until this temporary COVID setback, while measures of physical and mental well-being, unfortunately, continue to decrease. We had 3 years in a row where life expectancy in the US declined due to primarily to deaths of despair, addiction, and suicide. So that's really where we're focusing a lot of our time these days. We also like to look at things with a lens of stigma, so conditions and treatments and solutions that maybe have been overlooked because of stigma. And that's really what brought us first to focus on mental health and then to focus on psychedelics as well.
That's a great introduction. Thank you, Amanda. John, would you go next?
Hi, I'm John Cammack. I'm a partner in the Bridge Builders Collective. Charlie over there is the managing partner. And it's an impact VC firm that originally, Charlie said, was devoted to really working to scale mindfulness. And our new kind of decade commitment is to intentionally bring psychedelics into mainstream use where the fidelity of the experience is preserved, but we also create access. So how did I kind of end up being interested in that? Well, I've always been interested in the mind and consciousness. I read Carlos Castaneda, when I didn't go to class in college years ago. I experimented then in consciousness shifting. I kind of found meditation really was helpful to me just to function better and to let me explore different states of mind. So I've had that practice. And then by serendipity, I'm a resident in Baltimore, Maryland. And I found my way to build relationships with the researchers at Johns Hopkins that are doing the remarkable work with psilocybin. And in fact, I was an executive in residence at Hopkins because I'm kind of geeky and like science translation. So when I met Roland Griffins and the team and I looked at the quality of their work and the outcome data that I had, I said, there is something really significant here. And then over time, I began to meet the guides and the people who are the leadership of this movement as a movement of creating transcendence. So you have science in one place and transcendence in another. And it's like, I'm just trying to figure it out for myself. Like, where do I fit in this personally, as well as how is a capitalist and a philanthropist and working with Charlie and his colleagues, what are the right moves here to not screw the pooch here and get this done in a way that the power of the medicine works, but we also create a system where people that need it can reach it and have really good quality care.
That's great, John. Thank you for your introduction. And Alex, I'm looking forward to you introducing yourself.
Sure thing, thanks. Hey everyone, my name's Alex Simon. I'm very pleased to be here with you all. I'm zooming in from Brooklyn, New York, which is my home. And I kind of sit at a interesting position in this space, which has kind of given me the privilege of looking at it from a few different lenses. I actually, I have the good fortune of collaborating full-time with my father on various philanthropic and commercial projects related to advancing psychedelics, stemming from, really two things. One, the undeniable evidence for the, efficacy and general safety of these as far superior tools in the toolbox of treating different mental health issues that, are particularly plaguing society now, but have been for a long time. And then also just personally, from, having a few very acute cases of severe mental health in my own family, and, realizing that even with access to the different tools that are available, the tools are inadequate. So that kind of actually led me from a period of time where I was fairly active in operating and investing in companies at the intersection of agriculture and cannabis. So I do come from the cannabis industry, but don't hold that against me, to this space last year. And what I end up spending most of my time doing is working to support the different nonprofits and for-profit ventures advancing the space. And that really boils down to kind of three things. I do manage an investor community, so we're not a strict fund, but a community of folks who between them have invested in virtually kind of all of the kind of prevailing entities in this space. So do a lot of work as, serving as kind of a glorified telephone operator and clearinghouse for folks looking to deploy capital in this, brave new world. Supporting research, which actually we're doing through a variety of research centers, but namely at Massachusetts General Hospital, where we're advisors to a new Center for the Neuroscience of Psychedelics, which I can get into later, as well as, from a more philanthropic standpoint, as I think John was alluding to, this ecosystem is still very much in development, and the psychedelics bubble is still very much a bubble. So we do what we can to help build bridges both within the community, but also to build bridges between the really exciting, credible work being done and mainstream mental health philanthropists, mainstream politicians, mainstream biotech investors who should know more about what's being done, but still are unaware. So that's kind of what I'm coming to this from.
Alex, it's, as somebody from Bridge Builders Collaborative, it's awesome to hear someone else that's really passionate about building bridges in this ecosystem. And I wanted to ask each of you, after those great introductions, you each have a lot of investment background in different fields. And I wanted to ask you, as you approach this space, what's different for you as to how you are looking at this space versus other spaces, or maybe it's not, but I just wanted to get your opinion. And the way we're going to do this, just for the audience out there, is I'm not going to pick someone to answer that question. I'm just going to throw it out there and see who wants to start.
I'm happy to start. For us, we're not traditionally biotech investors. So, I think when we first started looking at this landscape, maybe 3 years ago, the investable companies on the for-profit side and many on the nonprofit side as well are working on drug discovery and the IP related around that. And so that for us is not necessarily how we would normally enter the mental health space. We decided to go sort of all in on psychedelics because we felt like the research was intriguing enough and there was enough of it that it seemed to be one of the most transformative approaches that we've ever seen to actually making a difference in the current scale of our current mental health crisis. But this is a different, this is a different type of investment. Obviously most of these compounds are Scheduled 1 right now. So there's a lot more work on the regulatory and legal side. So, the difference between decrim and legalization and medicalization and getting comfortable with where you're investing there. I think we've made the decision to support companies that are going through the regulatory process as opposed to going through more of a cannabis type process or any type of a recreational process. But there is a lot of heavy lifting there, and I think there's still a lot of dissent about that process right now. I would say the other big difference for us is that we're looking at this with a 20-year time frame. When we first started investing, we said there's so much unknown here that we really needed to be able to take a very long-term view here to be able to support the right companies and be aligned the right way with the missions and the ethics, et cetera, of the companies that we were supporting. So although early stage VC can often be up to a 10-year turnaround, sometimes people think about we're looking at this from a 20-year cycle.
Totally. I'll piggyback off of what Amanda just shared and echo everything she said. The other things I'd add are that I don't know that I've been involved in a space where saying I'm involved in psychedelics could mean so many different things to so many different people. Everything ranging from let's get excited about dispensaries carrying magic mushrooms, which I would agree with Amanda is a less likely future forward path, at least in the near kind of term, and less obvious from a regulatory standpoint, to a strict kind of drug discovery model that is compliant with the FDA. So I think that has made navigating this space generally and from an investor standpoint a bit more wide-ranging and exciting and noisy. Another thing I'd say is that and there's probably precedent for this going back, but this isn't just kind of a new treatment in a current paradigm of care or efficacy. This really kind of reframes the paradigm for how mental illness can be treated. And so I think on top of the regulatory challenges, there are a whole host of considerations that, basically go every which way in the ecosystem of how this is going to evolve. Thinking about a modality like psychedelic-assisted therapy, which is very, generally long, hopefully finite, and just really breaks the mold of what current business models are looking at. So I think that's a pretty different aspect that needs consideration whenever I'm looking at these companies.
I as an investor, it's a very intriguing but complex space that's already been referred to. If you could create a play with an interesting set of diverse characters, they're all in this field, right? From scientists to people growing stuff in their basement, and they're different sects and things. So you got to know what you want for your capital to achieve. You can't do it all. So you have to kind of think, what's the end world I, as an investor, want? And how do I navigate in a system that hasn't completely come together yet? There's a lot of unknowns here, right? On timing that Amanda mentioned, on regulatory change. So you got to be very patient, and you got to kind of pick your companies that have the capacity to evolve as this movement evolves. They need to have the ability to think long-term, survive, and flex to how things come together. And that's always in the back of my mind when I meet aspiring CEOs in this field, that can they get through the evolution that none of us understand quite how will come together.
That's great. I'm going to add one that may just be personal to me. I feel an added responsibility investing in this space than I have in anything that I've ever invested in before, because we're not just dealing, with mental health. We're dealing with sacred medicines, at least in my experience, that are extremely powerful to either help, or in if we don't do it correctly, they could harm. And just the nature of the energies behind what we're talking about here is so powerful that I feel this added responsibility, and that just may be me, but that's something that weighs on me as we look at investments. And it actually, for me, it's a part of how I look at an investment in the space, is how do people view that relationship. So I wanted to say that, but I also then wanted to sort of transition to, just as investors, we're going to get down to more sort of the grassroots. When you're investing in companies, what is it that you're looking for in a company, and is there anything uniquely different in this space as you're looking at companies?
Well, I think mission is really important. And are you going to be part of the problem of how this field comes together? You're going to be part of the solution. And that requires getting to know a CEO, not only what's up in his or her heads, but what's in their hearts. What do they really want, their company to do? And back to Charlie's point, I really think they were dealing with very powerful transformational compounds. And you got to honor that as a starting point here. And not let commercialization compromise the promise of these compounds really healing people. So I kind of think of it, does the CEO really have the resolve to make principled stands on how he or she wants to build this company that will make it successful, but not kind of some point down the road start to dance with the devil a little bit? And I, as an investor, are kind of there to coach them through those moments of truth, because I am an impact investor here. I want the good of the community, and that comes before I want my capital back. And so I look for those qualities in the people I would invest behind.
Yeah, I mean, I would just echo a lot of what's been said. I mean, Charlie, to your point about responsibility, I think, and what you said, John, there is a responsibility to the whole space, because I think we're all aware that there are risks with these substances, and depending upon what route a company or a founder is choosing to go down, there's a real risk that there is an incident or multiple incidences that, rise to the level of, slowing down all the progress and momentum that we see in the space. I think, we are comfortable as investors that the FDA is open, very open to these compounds, and recognizes the huge, the huge need in the mental health space right now, but you need only a few bad headlines to really start slowing down this progress. So I think that's also very important when we invest in anyone in the space. And to what we've all been speaking to about the state, the nascent state of this industry, I think you really need founders who are very flexible and very patient. We're talking about, as Alex, you said, an entirely new paradigm of drug-assisted psychotherapy, which we haven't seen before. What does a business model look that's built around, an episodic treatment? It's something very different than what we've had in the past. And I think anybody who tells you they know the answer today is lying or mistaken. So I think those are important qualities that we look for in founders as well.
Totally. All I'd add is, I think, as I guess the token kind of post cannabis person on the panel, there's multiple layers of kind of diligence, if you will, on looking at these companies. This is about as noisy a space as I've ever encountered, and I think that is for a variety of reasons. One, certainly capital markets, where formerly cannabis and before that, mining were very kind of popular opportunities, or transitioning to kind of embrace a hype cycle around psychedelics, which is probably pretty unfortunate in a lot of ways. And then I also just think there's most of the companies that are being kind of thought about and created with psychedelics are not easy companies to build or easy companies to go to market. This is not a lemonade stand type business. And so I think that just dramatically changes the ratio of signal to noise. And so I think thinking about whether the people who are doing this are really up to the long game. Thinking about the long-termism of I think all of our investing strategies around this is a huge kind of disqualifying factor in a lot of the companies that I'm looking at. I will say something that might be a little unpopular, because I totally agree with the gravity of the importance of the problems that we're solving, treatment-resistant forms of mental illness and serious things, as well as the significance of these incredible medicines that have been used for millennia, in which if I spend the next 100 years trying to understand them better, I'll only scratch the surface. I do worry in some conversations I have with entrepreneurs and others starting that there's such an indexing on doing this with the utmost integrity that sometimes can even crowd out considerations around how to build effective and sustainable businesses. Yep. I'm a little torn. I don't really have a concrete perspective on this in terms of, but I rather have an entrepreneur come to me with the utmost integrity and little execution ability, or vice versa. But I've certainly I worry a little bit that if we're trying to accomplish too many goals of basically solving every problem through the advancement of psychedelics and bringing more integrity to capitalism and all of that, which I think is super important. I wonder whether that ends up being a distraction from any single goal of maybe tackling particular mental health issues. So anyways, I'll leave that there.
I mean,
I was going to say, I saw heads nod, so let's rip on this question.
Yeah, I mean, I couldn't agree with that more. I mean, I think one of the things that surprised me about the space is how polarized it was. When you talk about investing in a for-profit company, sometimes I feel like I need to put on, my bulletproof vest in some of the venues I've gone to. And I think that's a really good point. I think, my belief, and I do support this movement, both philanthropically and in an investment side, on the investment for-profit side. But, I believe that for-profit business models are the best way to get these compounds at scale, accessible as quickly as possible to as many people as possible. I think that, that's been proven over time. And I think that there's definitely a role for the nonprofits as well. But I think that we do need people who can execute, because I think all of us on this call care about people having access to these things as quickly as possible. So, when we talk about one of the things we look at in the space, I ask many of the companies that I meet with in the space, should you really be raising institutional funding? Is that the type of business you want to have? Because I think there are people with a lot of integrity who can make important contributions to the space, but shouldn't be out raising venture capital funding, because that's not aligned with their goals, their timeline, or anything like that. And there's space for them too, but that's not, the space that would come from an institutional investor check.
I'll add one other comment. This is an interesting conversation. And I guess I emphasize kind of the mission, or I wanted people to have the capacity to make good judgments as they build their business. That was more, and to know the value of what they want to build and the integrity of that experience versus the economic model is kind of getting that right, where there's balance in it. That's really what I was saying. But my other comment would be, in my mind's eye, and kind of that what Alex is saying, if we're going to get this into the mental health system, you got to be able to build to scale, right? You got to get into payer systems. You have to get sustainable economics to support the time it takes to take somebody through these journeys and the integration. And those are going to be fairly accomplished people that take this all the way downfield. There may be some founders that can go part of the way, but ultimately to have the impact I want, which is accessible quality care using plant and psychedelic medicines that are offered with integrity to people who need it, right? Access and affordability are really key to me. You're going to have people that share that mission, but they can execute on that mission as your entrepreneurs.
That's great. That's a cool little riff on the discussion, and let's go to another place that's interesting, at least from my perspective. Hearing all of you, you've been involved in different fields. Alex, from cannabis, and Amanda in wellness, and John, you've been investing in many different things over the years: education, investments in brain, etc. Investments in mindfulness. It seems to me that this space is somewhat different in the interaction between for-profits and nonprofits. And Amanda, I heard you say, in this space, for instance, you've been investing in both. And I'm interested in your perspective. Is this different in this space somehow? And how do you look at investing in nonprofits or for-profits, and how will they work together?
I mean, I don't know if it's different in this space versus, in other spaces. And that I think that the most important question is, where is capital available? So I think, obviously MAPS has played, a critical, existential role in getting us to where we are today. And they needed to do that from a nonprofit side because there were not for-profit dollars. There was no business model there. It was so far away from what people thought would be an improved medication that they needed to raise money from donors as opposed to from investors. But I think once you move to more clarity around compounds or conditions, et cetera, I think that the right model, in my opinion, is a for-profit model. I think it's both faster, it's more sustainable because you're not looking for outside funding to support the operations. And I think those philanthropic dollars don't get cannibalized that way, because I think that there are, if you look within the psychedelic space, there may be conditions or compounds which, the total market size isn't large enough to attract the kind of for-profit dollars that you would need. But let's devote those to the nonprofit side, and let's save the companies that can easily be funded from a larger ecosystem for, I think that can be handled on the for-profit side. So that's kind of how I quickly evaluate if private market capital is available. That's generally a more efficient route, in my opinion.
Yeah, I think that the spotlight is really on MAPS to demonstrate the efficacy and sustainability and growth potential of a not-for-profit model. So I'm very optimistic about their prospects, but I think that's certainly the most grand scale and furthest along scenario. I mean, furthest really along in some ways of any of the entities doing any of the work. So I think that'll do a lot to demonstrate, the role of nonprofits. And I also think that, even if let's say a goal of mine is to make psychedelic assisted therapy as prevalently accessible and widely accessible as mainstream healthcare is in the United States, that's still inadequate levels of access and equity. And so I suspect that even if, capitalism goes to work in the best possible way to bring these treatments to scale, there will still be plenty of room for nonprofits and alternative models to ensure that all the different cracks in the accessibility question are being filled. So part of me does wonder. I see a lot of organizations starting with a very kind of access forward stance, which I think is good in a lot of ways. But part of me does wonder, I think perhaps to the cannibalizing point that Amanda made, whether there are going to be a lot kind of a graveyard of nonprofits left behind, trying to use money that would otherwise have been used by for-profits that have much easier time raising money to test out models and increase efficiencies of some of these treatments that then nonprofits down the line can pull in and operate most effectively. So I think it'll be a little messy, but there'll certainly be space for nonprofits alongside all the for-profits. And I'm not as concerned as maybe some others about one or two for-profits swallowing up all the potential to do this work.
my thinking went to, and it's, again, this is a great discussion. It's invariably successful things continue to scale because they create demand, because they do a really good job. So how that will play out, but you need capital to get there. You know, you need to hire better and better people. So for-profit usually is a mechanism you can keep doing that. Not-for-profit, we're still learning how those models really work to continue going. I will say that in the space of psychedelics, the part of me, and maybe Charlie, you're going to take us over to this discussion, but I do think we need to have an institutional presence of not-for-profits that are setting the values in this field, particularly in the delivery of clinical service, because we don't have a professional society of psychedelic therapists or medicine yet. It will emerge, but you need communities of interest that share their knowledge and values to hold people to a high standard and a commitment to keep learning how to work with these compounds and work with people. So I kind of think, well, I've got my capitalist hat on, but if I have my philanthropist hat, I want those organizations to be created and succeed because we need them here. And then the other part of the ecosystem can have some guide rails put around it, around behavior, practice, what's in scope as a healer and out of scope.
Yeah, so we've kind of talked about my next question, and John, part of what you were describing there kind of gets to it. But what concerns do you have for the space? I mean, we've been down this road once 40 years ago. It's very different this time in many ways. Maybe it's not as different as what happened 40 years ago. But what concerns do you have for the emergence of this space that you think about as you consider investments?
Well, I'll go first. We're dealing with these controlled substances that are still illegal. And while there's a growing community of people that see the promise of these compounds, there's still influential people that see them as a threat. 50 years ago, people that saw these compounds as a threat were able to stop the use by making them controlled substances and stopping all research. And boy, what we lost from that is immeasurable. And there was still an underground that did it, but it just got stigmatized. And so I think we need to bring this back above ground in ways where we move this forward, but we don't have actions or outcomes that give people in power a case that this should not happen. I also think this should grow on the merit of the power of the delivery of these compounds to help people, and it should not become a political issue. And almost everything in our country now is getting polarized, and it could be an opportunity for different groups to see this as a threat. And I pray that doesn't happen, but it's a risk, and everybody should work to try to avoid that happening.
Yeah. I mean, call me crazy, but I think one of the biggest liabilities of the psychedelics movement, whether it's on the commercial, investing side or really any aspect, is the psychedelic centric nature of it. I mean, don't get me wrong. I am a big believer in these compounds and medicines, and that's why I spend all day doing what I do. But the most successful conversations I have with major institutions who are not already on the psychedelics bandwagon happen when it's all about mental health, tackling the mental health crisis. And that I even say at the end of most of my conversations with these people, one of the only reasons I'm involved in psychedelics is because I'm looking for innovative, effective treatments of mental health issues. And psychedelics are by far, psychedelic assisted therapy is by far kind of the most effective, promising, currently underutilized, modalities I've come across. Like, what else should I be looking at? And I haven't really come across very many good answers to that question. And I think that, that speaks to, if the liability John mentioned is definitely kind of issue number one. If we can't make some very basic progress in actually making these therapies regulated and legal, all the other stuff is kind of irrelevant. But how you talk about this work and how you present yourself, whether as a company founder or as an investor or as an advocate or anyone, I think is really one of the most important things, because a lot of education still needs to be done outside the bubble.
Yeah, I definitely agree. I think that, the psychedelics are, people who are excited about them, and rightly so, often pitch them as a panacea. And I think there's a real danger there. And even talking to researchers in the space, they've said that, when they're enrolling people into trials now, they in a way have a much harder job, because a lot of people come into that with a set of expectations that they wouldn't have previously. And while I think it's wonderful that there's been more discussion in popular culture of these treatments, and I do believe, as you believe, Alex, that, with everything we've looked at, and we don't think there's one solution, and it's certainly not psychedelics alone. And as we keep emphasizing, it's psychedelic assisted psychotherapy, and that is, 50% of the treatment at least. I think that there's a risk that the hype gets ahead of the science, and the hype gets ahead of the results, because I think the people who have the most success with these compounds are people who are doing the integration work, which doesn't stop with one session, who are, continuing to implement changes in their life and taking advantage of this window of neuroplasticity. And I think, we'll see if the science bears this out. But, if these are pitched as a one pill wonder cure, I think we're setting, everybody up for a quick fall.
So I'm going to add one concern. It sort of riffs on what you were just describing, Amanda. So we have a healthcare system that a lot of times to me seems like it's about, it's a sick care system. It's not a well care system. And these drugs, while or compounds or plants or however you want to describe them, they're not one hit wonders, but people have remarkable experiences that with one or two sessions, and if done correctly, make changes that actually will change healthcare costs. And one concern that I have for the industry is, how do we not develop an industry of dependence, but we develop an industry that really is about improving the healthcare, mental well-being of spirituality, so that we don't need as many drugs, as many mental health interventions, etc. And this is where, from my perspective, capitalism can kind of come up against this space a little bit. And how that all emerges, and how we support people, with their mental health. I just think that's going to be interesting and fascinating. And I get concerned that we don't get into a system of saying, well, I need this, and then I need this again 3 months later, and I need this again 3 months later. I just really hope and pray for the mental well-being, and for our country, and that people will need less care because of it. I'm gonna switch now. So we probably have a lot of entrepreneurs who are watching this, and I would like each of you to, provide the counsel as to how you like to be approached, and what's the best way for an entrepreneur to have success with their pitch, or if they have a new idea, what are things that you look for when you meet an entrepreneur, or things that they can improve in the way they're pitching to you?
I'll go ahead. I mean, one thing that I see a lot is kind of, it can be couched in different ways, but fundamentally a lack of focus. This is a really exciting space. There are a variety of verticals through which you can try to build businesses, and let's seize the opportunity and basically try to build businesses simultaneously in all of them. And I mean, this is not specific to psychedelics. I'm pretty allergic to that approach generally, but I do think it you know is happening quite a bit. You know, companies looking to build clinics and technology, and maybe explore drug discovery, and maybe we'll do a little bit of this and a little bit of that. And that seems to be a pretty good strategy if you're trying to generate exciting PR regularly, to you know to be received well by retail investors. Anyways, I'll go off that tear. But I honestly think a lot of it is pretty basic stuff, not specific to the psychedelics world. I talk to a lot of extraordinary technical entrepreneurs who could benefit hugely by having some dynamic, kind of more entrepreneurial folks at the table, and vice versa. So I've been thinking a bit about what can be done to merge some really smart entrepreneurs and business people with some of the top kind of researchers or scientists approaching this, because I think I see, you know, that asset and liability going both ways in a lot of the companies coming to me. And yeah, I mean, I'll be quiet for a second and let others speak.
I mean, I think we've talked about a lot of the things that are specific to the psychedelic field and what would look for, you know, there. I would say just, you know, one more thing is that, you know, this is not cannabis. And so many people have approached us from that mindset, with all due respect to Alex and your experience. And not that there's anything wrong with cannabis, but again, that's a product and these are services, and it's a completely different, we believe, route to market. And I've had too many people pitch me ideas without really understanding the regulatory structure or what they're legally able to do. And if they're taking a legal risk, they should at least understand what that risk is and be able to quantify it and explain it. And, you know, certainly that's not for us. You know, and then just all of the other things that we mentioned in terms of needing a certain amount of integrity. I think we've also felt that there's a ton of, you know, scientific and clinical talent in the space that maybe hasn't been fully matched yet with business talent to be able to turn those all into sustainable businesses. And that some of the business talent has maybe been focused more on the PR cycle as opposed to actual progress in the space. So, you know, just trying to sift through all of that and find the sweet spot.
I don't have much to add. I'd say team matters, or at least having the right talent. I think here it's understanding the way you're going to go to market and the value proposition you want, and having the capacity to pivot if the marketplace around you changes, which in this space could happen very quickly, I think, to have the resources or capacity or bandwidth to successfully pivot and find a new value proposition. I think that would be very helpful to entrepreneurs. I thought you were asking, Charlie, how do we want to be approached? And I welcome people with self-agency that want to make the world better. Usually, you know, it's a fairly short first conversation and a deck that really lays out what they want to build and how they're going to go about it. And that's a good starting point to form a relationship.
That's great. So one of the things I love about panels, and I normally try to put as much time for audience questions as possible, but since we're not live, and I'm changing it up a little bit, and I'm going to go, you know, sort of person to person, and ask them to ask somebody else on the panel question. So I'm going to start with John, and I'm going to have you ask Amanda a question. Amanda, I'm going to then ask you to then pass the baton and ask Alex a question. Alex, you can ask me a question, and then I'm going to hit John with the hardest question. I'm going to save that one for last. Just kidding. But yeah, let's do Q&A this way.
Hey, Amanda, I've been thinking, do you find the drug discovery part of this more interesting, or the service delivery part of it is kind of and it could go wellness or clinical, whatever. Which is more intriguing to you?
And please ignore my 5-year-old who's banging on the door as I as I answer your question. You know, work from home. You always need one of those moments. You might make it through any moment. So, you know, I think that, you know, as I mentioned before, so we're not biotech investors. So I think the drug discovery side is incredibly interesting, and we are investors in Compass Pathways and Atai, who are both working on the drug discovery side. And I think that work, you know, needs to be done. You know, it's expensive. It takes a long time. It needs to be done the right way to ultimately be able to increase access and scale. So, you know, we've looked at some of the other compounds. I think if we look, you know, 5 years from now, the space will hopefully have a couple, MDMA and psilocybin will hopefully have gone through a legalization, medicalization process, and that we will have progress on other compounds like ibogaine and DMT. But when we look at the landscape as a whole, I think we see there's, you know, a physical infrastructure piece. So that's, you know, the clinics that we talked about. I think, you know, it's really important to understand in this ecosystem, you know, what does distribution look like? And I think, you know, that is still being discovered and what the players will be there. You know, there's a human infrastructure piece in terms of therapists and in terms of scaling up enough practitioners to be able to give this kind of care, because as we have spoken about, the therapy part is actually, you know, 100% a part of what this treatment is. There's a tech layer, which in some ways could look like, you know, an electronic medical record system, and in other ways it can digitize some of that screening, you know, pre and post experience pieces. And then we get to the IP, which is both on the drug discovery side, and I think there's also IP around protocols and building protocols. So I think there, you know, is a lot of early research around set and setting, even what types of music you're using, you know, what dosages, which really shouldn't be based by weight like the pharmaceutical industry is used to, but could be based on other factors in a person's history or other physiological factors. So I think all of those pieces are interesting and ripe for investment. And when, you know, we're willing to look at all of them, I would say. So I think that we're willing to still know what we don't know. So open-minded in terms of trying to figure out which part of the ecosystem will ultimately reach scale, but certainly drug discovery is an important piece of that. And so I guess I have a question, you know, for Alex, also wearing, you know, your investor hat, because I know you're involved in all sides of this progress. But when you're looking at things as an investor, curious, like which, you know, I sort of laid out how, you know, one of the ways that we're dividing the landscape, but when you're dividing the landscape, what do you think is the most promising area right now for investment on the for-profit side?
I think I mean, timing is everything in a lot of ways, but I think if you do remove timing from the equation, the kind of ancillary picks and shovels side of this is the most exciting. But I think there needs to be a lot more kind of activity before some of those business models can be validated. I mean, drug discovery is, I mean, it's certainly interesting and probably will be the largest kind of market period in, you know, in totality eventually. But I'm not a scientist and don't really have any comparative advantage in assessing some of the you know, technologies and mechanisms of action that I'm being pitched. I guess that kind of leaves me with some of these clinics. And I guess a big question I have around looking at clinical, you know, the efficacy and viability of clinical business models is between now and when MDMA and psilocybin and et cetera are approved to be used beyond trials in clinics, will, you know, ketamine-assisted psychotherapy or other kind of real opportunities fully manifest? So I would guess I'd say if I could find clinics that had really really good model for how to deploy the ketamine-assisted psychotherapy and other kind of equally intriguing opportunities, that would be of interest. But honestly, I don't know. It's a tough thing because I am in the macro very enthusiastic about this space, but when you actually drill down to some of these businesses, I guess maybe that's a good investor trade. I have curiosity and skepticism about all the areas, but I generally agree with the way you kind of broke down the space. And I guess now I'm supposed to ask a question to you, Charlie.
Yes, correct.
To quote a bit of a lightning rod in this space, Peter Thiel, what, and I won't get the exact quote right, but what is something that you believe to be true about this space that runs contrary to kind of conventional wisdom or what mainstream thought is? Mainstream within psychedelics.
I guess the answer to that question may not be, may not be contrarian. I don't see this as just the best way necessarily, to improve mental health, which I do. I haven't seen anything. We've been investing. John and I and our partners have been investing for the last 9 years. There's nothing even close. But for me, there's another piece, which is the collective good for humanity in bringing this forward ethically to help us to wake up to who we are, to what our purpose is, why are we here, to live to that purpose is another outcome that I think is very interesting to me. Because I think some of the things that I see, even from the research, is that, sort of the mystical experience within the experiences that people have is something that is life-changing. And yes, there needs to be integration from that, et cetera. But this isn't just about improved mental health for me. It's really about human flourishing and how do we survive as a species together. So I really want to be a good steward of how do we, sort of bring that out ethically. So I guess that's the answer to the question. And then John, I'm gonna end with you. So we've talked a lot about this, this ecostructure or ecosystem in our country, but there's, this is actually a global, movement or industry that's been around for long times in different places. How do you see that sort of playing out from an ecosystem, the way different countries treat this, the different rules of different countries, legalities, et cetera? And is there anything that you take into consideration as you look at making investments, either for-profit or nonprofit?
Hey, Charlie, I thought you were just going to ask me when I'm going to do my next trip. Oh man, you laid that on me. I don't know if I can handle that right now. You got to respect the indigenous traditions, and culture has embraced these plant medicines in different ways all over the world. Those traditions should be honored. And then there'll be different pace of legalization, different parts of the world. So Netherlands and Jamaica have more liberal rules. I think it's an evolution. My passion really is for the US to embrace this in a conscious way that creates successful healing at very deep levels for people, because we need that. We're a fragmented society, and we're fragmented and fearful inside of ourselves. And human beings kind of run the planet, right? And you can make an argument we're not really running it all that well, because we got the incentives for use of the resources of the planet to create short-term pleasure are not aligned to the balance we need. So I kind of see this as how does the globe begin to use this? And then it's probably another maybe a year from now we reconvene and it's, how do you get these in the hands of the people that have power? And quite frankly, a lot of them would be, you know, heading to their community or their tribe right now. But in a way, it's really interesting about adoption across the world, but also how does this get adopted and used in institutional power and what emerges from that? Because 50 years ago, that was stop dead. This just stopped, you know, and this time, let's just go with the flow and see what emerges from that opportunity.
Great. Well, I want to thank each of you for sharing your wisdom and your questions and your insights and your experience to this panel. It's been really fun to hear each of your different perspectives and to be able to sort of collaborate on answers. I hope everyone has a, you know, that's watching is having a remarkable Burning Man experience, even though it's very different than anything, you know, that you've ever ever been to before. And really thank you to Amanda and John and Alex for joining me for this hour of discussion.
Thank you.
Thank you,
Just
Charlie.
being with everybody.